Welcome and bienvenidos to our new program called Next Generation, highlighting the many creative journeys of next generation leaders. In this series, I will bring you the stories of young leaders in science, literature, medicine, education, and business. Those who have chosen to reach further, travel farther, innovate, and take the risks often necessary to make a difference in their own lives, in those of their families, their communities, and someday in the world. My name is Julieta Garcia. For over 22 years, I had the great privilege of serving as president of the University of Texas at Brownsville. Through that work, I came to know the stories of many of our students that overcame great obstacles to attend college and through great sacrifice of their own and of their families, make it through. Getting to know their stories was always a great inspiration to me. So I thought I'd chase some of them down, interview them, and let you hear in their own words what they're up to now, what their challenges were, and what they hope to accomplish in the future. I promise you will be as inspired, amazed, and humbled by their accomplishments as I have been. Now let's get started. It's my pleasure to welcome Dr. Belinda Reininger to our podcast today. Dr. Reininger has been appointed Regional Dean of the University of Texas Health Science Center at Houston, which is also called UTHealth, School of Public Health in Brownsville. It's a wonderful collaboration that we've had here for many years now, where you can actually get a master's degree in public health and sit on the Brownsville campus through the arrangement with the School of Public Health at the UT Health Science Center at Houston. So one of the benefits of that is that we have professors like Dr. Belinda Reininger on our campus. And so we are welcoming her today to talk about the kinds of work that she has been doing for many, many years in the Rio Grande Valley. She is also a professor of health promotion and behavioral sciences. She has multiple degrees from the University of Texas. She's a graduate of University of Texas at Austin with a bachelor's degree in education, a master's degree in public health, and a doctorate in public health from UT Houston School of Public Health. And she's been working in higher education and public health for now over 24 years. She has 70 scientific publications, which is extraordinarily extensive, and has been invited to present her scientific research in Mexico, in Pakistan, in Scotland, in South Africa, and extensively, of course, in the United States. In 2015, she was a sole winner of the Associations of School and Programs of Public Health Pfizer Faculty Award for Excellence in Academic Public Health Research. She has also been awarded the highest award that a teacher, a professor, can be given in the UT system, when in 2016 she was awarded the UT Regents Outstanding Teaching Award. She has a passion for public service, and that's why we've invited Dr. Reininger to talk with us today. So I know she's done so many other things. The other thing I wanted to mention also is that she has been on the board of the Harlingen Independent School District. It's extraordinary involvement because it's from farmers market to doing extensive research to leading collaborations across the state of Texas and elsewhere, and doing that work at home too. She is also a mom and a wonderful wife and has 3 children. Yes, well, let's see, Kenneth and Corianne and Kennedy. Dr. Reininger, thank you so much for accepting our invitation to join us today.
It's my pleasure to be here, truly.
Okay, so I want you to tell our folks about the kind of work you're doing. As you know, this is about the next generation of people that are having impact. And you're certainly one of those that I wanted to highlight because of the extraordinary impact that your work is doing. So you explained it in your work that you are about developing, implementing, and evaluating. Tell me what that refers to.
Sure, glad to. Really, everything that we've done with the various partnerships and the work, we take that approach like you talked about. So developing, planning it well, right? Thinking about it, planning it well, basing it on evidence, then implementing it well so that you're looking at fidelity. You're making sure that what was done before that worked is being done again, and ensuring also the the cultural relevance of it, the elements are there that make it work, and then evaluating it, making sure that it's achieving the same impact that was either achieved before or even more. So it's thinking through all phases of that, and that continuum then is what makes for good programming, what gets the public health impact that we want, better health.
So your whole career has been spent trying to aim at public health, right? I mean, it's research that takes what we learn in science and in our research and apply it real time to people. And you've chosen to apply all of your investigations and that others have done, apply it to Brownsville. How lucky could we be to have you here and doing that kind of work? So give us an example of how you have taken an idea that stems from a problem in the community or concern and then tried to attack it and approach it, install it, and then evaluate it.
Great. So many possibilities. But we'll start with an early one, which was around the Brownsville Farmers Market, which is just a tremendous success, and a success because of so many people really working that, the market and growing it and caring so much about it. But the idea came from the fact that we have lots of an excessive burden of diabetes and obesity in our region. And this was many years ago.
How excessive is it? How
right.
different
So
is it here?
it's depending on the issue, it's greater than national averages on all accounts. And for example, obesity rates are double what they are in other places. You know, we're leading the way in the wrong way, right? Not what we want.
When you say diabetes, remind us type 1 and type 2 and which one is prevalent here.
Right. Type 2 diabetes is particularly prevalent here, far greater, a little bit more than double what we see nationally. And particularly worrisome, and this is based on work of my colleagues, Dr. Susan Fisher-Huck and Dr. Joseph McCormick, with a locally curated cohort from this area. So these numbers are very accurate and very well characterized from the Valley.
And type 2 means what?
Well, type 2 diabetes is a diabetes that results from genetic and lifestyle factors. And so then the body is unable to really produce the insulin that it normally had, and so then medications are needed to manage it, and it's a condition that then becomes what we call a chronic condition, and something that we then have to manage over time, and that's really the result of those lifestyle conditions.
So you're not really focused on the genetic part of it. You're focused on, as I understand it, on the behavioral side of it.
Right.
What can we do to help create an environment, an opportunity for us to reduce the number of people with type 2 diabetes?
Exactly.
And so that's where we start. It's a severe issue, and as a community, we want to do something about it. So tell us what you've been doing.
Right. And that's really the trick of it. That's the important piece of it, that it's not one thing that a community has to do. It's multiple facets, and thinking about it, in fact, from what can we do as an individual, right? What can we do in that realm? What can we do in our interpersonal relationship realms? And then what can we do at the community realm? And then also at that societal policy realm, because all of those levels is what impacts these health conditions. The easy problems have been solved. What we're left with are these complicated issues. So then, thinking back to the farmers market as an example, we knew that diabetes and obesity rates were very high. We knew that there were food deserts, as they call them, areas where we can't really get healthy foods. And we knew that when we knew this meaning we were looking at the research to tell us this. We knew that from the research, when you put markets in place, farmers markets with healthy food options, produce in particular, in place, that families, in the case we were looking at was a study around a WIC family, individuals who access the women, infant, children supplement. And when they had access to these healthy foods, not only did they eat healthier, but they sustained it over time. So taking a lot of different research, putting it together, that was a spark for saying, here we live in this beautiful area with wonderful produce, but yet we don't have a farmer's market. And then from there, the Brownsville Wellness Coalition has just taken it and run with it and developed it. So that's one piece. And in that, there was the research to start it, to plan it well. And there was a lot of planning that went into it and lots of community groups and community leaders who came together to do that. The implementation of it, always with a mind of making sure that, we're serving low-income families, we're making this accessible, that we're bringing it fits our cultural circumstances and choices here, and then evaluating it, making sure that we're reaching who we need to reach and sustaining the efforts. And so the Brownsville Wellness Coalition has just taken that and run with it. But that model is there. Planning, implementing, and evaluating.
So I've been to the farmers market, and it is so much fun. And so tell our listeners a little bit about where is it and what can we find there, and when does it open, and when is it available to us? Right.
Well, so the farmers market is still in its original location at Linear Park, right near the zoo in the Brownsville Midi Cultural District, and there's local farmers and with a ton of different produce options, but the Brownsville Wellness Coalition has even gone beyond that, and they offer free yoga in the morning. So now you can get your healthy foods and be physically active, and I think that that kind of transitions to another example of ways that we've done. The planning, implementation, and evaluation. Recently, in the last 5 to 6 years, again, a great team of organizations, clinics, and nonprofit organizations and community leaders have come together and worked on creating the Saluda Vida program, which this program is particular for individuals with uncontrolled type 2 diabetes. So they're in a position with their diabetes that it's not being managed as well as it could, which means they're putting themselves at greater risk for some of the consequences that follow diabetes. So this program, I think, is really important to talk about because it's focused on how do we develop the next generation of healthcare for the Valley. So the partners are clinics who are doing just fabulous work, providing care, right? Our federally qualified health centers, free clinic in the Hidalgo area. And so the clinic partners have been doing the work of providing extraordinary care for many people. And this allowed for this group of people to now think about how do we bridge from the time we're in the clinic office to when we're at home and we're trying to still make those healthy decisions, and it gets more complicated, right, when you step out into real life and all of that's happening. And so we created this continuum of care program where we've added the outreach elements. So we have promotoras, or otherwise, community health workers who are really highly trained in working with individuals in their homes. We offer community-based diabetes
self. Tell me a little bit about the promotoras.
Yes,
it's such a wonderful idea, and it's had so many iterations over time.
Absolutely.
So you're using promotoras, which are community-based men and women that are working on your behalf to go into the homes. And what do they do when they go into their their
They do
customer
so
service?
much. It's really remarkable to be able to come into someone's home and start talking about all the factors that are influencing choices that then influence your diabetes. And so they do kind of typical assessments to find out what are the factors that are maybe creating the stress points. They'll do a technique where they talk about motivational interviewing. So it's a particular technique that allows people to think through what is the issue that's impacting their diabetes, but also to derive the solution. And because of that, because it's self-driven solution formation, then they're able to implement that. And then the promotoras are following over time, sometimes 24 months and beyond, following over time to help make those baby steps.
It's extraordinary. So it's not one visit to the doctor when you're in an emergency situation.
Right.
It's quite the opposite of that. It's sustained, it's targeted, and you can follow the progress of the impact that you're having. So promotoras, we could talk about all day because it's so fascinating.
Yes.
But so diabetes is part of that. The farmers market is another part. Tell us about the bike trails and the bicycle, the walk and bike trails.
So another really important part. So we talked about like a community program with the farmers market, and then the Saluda Vida, helping individuals and creating that continuum of care. But there's also, we know from research that the environment in which we live, the opportunities that are in an environment are also impactful for health choices. And so, again, the Collective Action Board, this wonderful group of organizations and people have set together for 15 years and said, changing our environment is important, giving us opportunities is important, and then working with multiple cities in Cameron County who have come together, which that in and of itself is extraordinary, and said, we have a common vision. We want to be connected via trails. Our residents want to be able to go from one place to the other.
How connected are we, Doctor?
So we're on the way to having over 400 miles of connected.
That's amazing.
It is. And not just on road, to paddling, too.
Yes, that's right. Okay, so tell us a little bit about So you said connected. We're on our way to achieving 400 miles. So from Brownsville to South Padre Island?
South Padre Island to Rio Hondo. Los Fresnos, Rio Hondo, Combs, Harlingen, San Benito, Rancho Viejo, all of these.
So you could bike all the way through there, and you all produce trail maps, I would assume.
So that's what the process is. So the plan has already in place. We've just recently broken ground from the piece from Brownsville to Los Fresnos. So it'll be the first connecting piece, but there's catalyst trails that will really build that infrastructure, and then it just keeps connecting.
And these trails, we're in an environment where we talk often about my land, your land, my fence, your fence. Right. You all are fenceless. I mean, you are thinking not how to divide, but how to connect.
To connect.
But you're reusing land, right?
So it's a combination. So there's some on-road trails, there's some off-road trails using levee systems, or there's a great partnership with Parks and Wildlife, and so there's parks involved. There's
museums also.
It's connecting all of these natural resources and cultural resources.
So how many partners?
Oh my goodness! Well, at least 40.
Federal, but state, and local.
Every level. University, UTRGV is a big piece of it. Every level. So that is truly... So that is one of the projects, again, generational impact. Because we put that type of footprint down. Again, research tells us if there's these kinds of systems in place, people use them. They'll be more active. And it just has that trickle effect.
And those of us who have lived elsewhere, we lived in Austin for a while. We lived in Houston for a while. And I know that in Austin, I kept thinking, this is the greatest place for poor people to live. Because when you're a student, you're poor. Absolutely. And you have no resources to spare. And there were trails, and there were walking trails, bike trails. Our children always had access to those things. And that's not always been the case in our town. Our own town here in Brownsville. Right. So thank you. Just let me get that out, because this community benefits so greatly from the work that you and many others have begun, have sustained over time, which, as you said earlier, is generational. You plant a tree not knowing if you're going to walk under its shade, and that's what you've done. You've planted, trees for health, and you've implemented them. You've gained trust among collaborative groups, which is in itself an important part of it. And then you've gone back to say which ones were more effective, and so where should we reinvest in the future? And then you've taught us the results of your research. I think that's extraordinary. So, muchísimas gracias. Just so I say it out loud and on behalf of so many of us and our children and our grandchildren that are going to benefit from the work that you've done. Thank you for taking that focus and for doing that work in our home and in your home.
It is truly my pleasure.
So before we finish up, there's so many more models, and you'll have to come back and teach us more. But if you had to look forward a little bit, and you said, "Okay, done." Of course, we're never done, right? But if you feel like you've touched several key areas of concern, what are the ones that you're thinking about in a focus for the future?
Yeah, that's a great question. I do think there's so much that we have left to do and should focus on when we think about that continuum of care, and we as a country get better at understanding how what we have in our everyday life and what we don't have in our everyday life impacts our health. And so putting resources that go into prevention of disease. So there's a lot of work to be done there. Are children teaching parents? Is that part of this, the results? Yeah, I think there is always that interchange, right? We learn. We hear things out of our children's mouths that are so profound, and their passion. For example, right? I do think the younger generation is teaching us about that true desire to do something about the environment. There is a motivation and a passion around that that has. I wouldn't say it's absent from older generations, but there's something remarkable about what's happening, and I think that's really promising. One of the mothers that was interviewed, one of the mothers that was interviewed in one of the videos that I looked at said, in talking about the farmer's market, was just passionate when she said, now our children can come here and learn what we've always known intuitively, and that's where food comes from. Right. And I thought that was a lovely way to connect that dot, because our kids think, and many of us think, food comes from H-E-B or from the grocery stores, and don't understand where it came from before then. And so seeing people sell carrots with the roots on the carrot still, and all the other goodies that they do, and making their breads and their spices and their aromas and all the lovely things, the cookies. And I mean, that's got to be teaching us about how important the processes are that often are skipped. That's true. When we don't understand that. So if there is there a problem in the Valley that you think your focus is going to move toward in the future, or the problems that you're dealing with right now are not solved yet, obviously? Right. They're not solved. I think that in terms of the future, I think there's some really interesting promise in how we use technology to continue to address health issues. And as you can tell, just as you mentioned, serving on the board of trustees for the Harlingen School District, education is also at the heart of heart of what we do. We can't really pull apart health and education. They truly go together, and there's just such tremendous promise when we build educational systems that are transformative and into the future, planning for the future, what we can achieve. And there's some relationships that we can look at between school districts and our universities that are remarkable and are going to be transformative as well. So there's a lot of excitement. I have a tremendous excitement about what we can do around health and what we are already doing and can continue to do around education.
Well, it's one thing to start out the discovery and the work on a problem. It's quite another to try to help it move to its next iterative form. And you all have set the infrastructure in place of trust and familiarity, which are so important when a collaborative project is the only way to solve an issue. And without that, you can't take on the next issue. So thank you very, very much for spending so much time building the trust among community members. I remember when the School of Public Health first came to Brownsville. I mean, I was at the board meeting when it was decided that we would have this in Brownsville, and Harlingen would have the other part of the medical school, and they call it triplets,
right?
And the other part in Hidalgo. So, and I know it was a little hard at first to understand how does that distributive model work. And then we created UTRGV, and we said the words again, a distributive model. And it's still plugging along, having growing pains as we try to understand. And I think we always will be. That it's not meant as a criticism. It's simply when an issue like higher education is so important and there's such need in the community, you have to invent new models in order to deal with it. You can't wait until you grow another of the old ones. Right. So you have done that in public health. You and your colleagues and the McCormicks, of course, who were originators so much of the work in our School of Public Health. You too, though, you came with that initial group. You were part of it and have stayed and have done extraordinary work to have great impact. And then to have moved it out of the lab and out of the university and work with so many partners on both sides of the river through communications and mass communications in other areas. I mean, thank you, because the model that you have developed of how to do your work and how to connect the university and the scientific research that goes on there that we absolutely need with impact real time is extraordinary. So muchísimas gracias. We thank you with all of our heart for that work that you've done. So I have one final question.
Okay. So
let's say I had a student group here of about 50 students, and they were thinking, what should I study? Or what has Dr. Reininger learned that will help me in my own? I'm not so brilliant as she is. I'm not so smart. I couldn't do all of that. Maybe a little bit of advice, a little bit of consejos to our students about what has your experience taught you about having broad impact?
Well, I think the first thing is that every person can have an impact. And so it's stepping into that and knowing that by being a part of it, not only are you learning, but you're changing and you're contributing. And it's so rewarding to be in that place that you will just gain and grow. So find a place to plug in and start to grow there and learn the skills there, because it's one thing to hear about it in theory, and it's yet another in a deeper, richer way to experience it by stepping into it. Those internships, those summer program opportunities, those volunteer hours, those whatever opportunity you can take to actually contribute, do so. And then from there, it will teach you what you really will thrive at, what you really don't like, which is just as valuable, because then you can alter your course accordingly. It's and there is nothing more valuable than networking and creating those relationships, because those will sustain you. One never knows when it'll circle back, and that'll be a job opportunity or a reference opportunity or a class project opportunity, et cetera, et cetera. And so, but if we only stay restrained to what we know and what we the labels we put on ourselves of what we can do and what we can't do, we're limiting our experiences.
So you have just heard clear evidence of why Dr. Reininger received the Teaching Excellence Award, because she was just in a cogent and very authentic way giving our students the kind of advice that we try to figure out how to connect with them on all the time. And so how proud I am that you are part of our work and that you have dedicated so much of your life and energy and professional life and personal life to contributing to the Valley's good health. I hope, just so that your evaluations can look better, we do better. And so we'll pledge to try and follow your lead and keep learning from your example and be cooperating in the important work you do. Thank you. Thank you so much on behalf of all who have benefited and who will continue to benefit from your good work.
Thank you.
Thank you for tuning in to Next Generation, a program highlighting the next generation of leaders in the Rio Grande Valley and beyond.